This segment of DelmarvaLife is sponsored by TidalHealth.
You know, it's hard to miss the pink products, the pink ribbons, and pink-themed social events across Delmarva. Each October, pink has a pretty important purpose: to motivate people to learn their risk of breast cancer. October is Breast Cancer Awareness Month. Breast cancer is the most common type of non-skin cancer in women in the United States. In men, you can get it too, so listen up. It's also a cancer that can be detected and treated early, leading to good results. Carrie Kellums is a nurse practitioner with TidalHealth Breast Center, and she joins us with more. Thank you so much for being here.
Thank you for having me. I appreciate it.
So we every October we mark it as a Breast Cancer Awareness Month. Why is that month so important? Why is it important to bring awareness to breast cancer?
Well, women, we are caregivers, so we spend a lot of our lives taking care of aging parents, our children, our families, and a lot of times our own health tends to take the back seat. So having that month to really just highlight the importance of mammography and prioritizing our own health care is really important.
Yeah. So what's the number one thing that women can do to prevent breast cancer?
Generally just healthy living. I think it's really important to manage our weight. Obesity can increase your risk of breast cancer and other cancers. Limiting alcohol, staying physically active, managing stress. Breastfeeding, believe it or not, can reduce your risk. And being careful about hormone replacement therapy after menopause is important too. But just prioritizing your own health, managing your stress, and just trying to live a generally healthy life.
Of course, you have tools to detect breast cancer, such as mammography.
Right. So we have something called tomosynthesis or 3D mammography now, which increases the sensitivity of mammograms in detecting early cancers in women, especially with dense breasts.
So when should we start getting our mammograms?
For most women, at age 40 is the general consensus. But with that said, always important to be aware of your family history. We do at the Breast Center offer genetic testing for women who are candidates for that based on their family history. Some women who have a strong family history or a genetic mutation that increases their risk might need to start earlier.
And if you don't have that risk, how often should you get a mammogram?
Once a year. Once a year is the general rule.
So what about self-exams? What role does that play?
Oh, self-exams are so important. I hear all the time that women don't want to do self-breast exams because they feel like they have dense breasts or their breasts are just generally lumpy. But just the important thing is to consistently do it every month. That way you can learn the landscape of your own breast, what's normal for you, and that way if there is a change or something new that develops, you'll be the first to detect it.
And we are so fortunate to have the TidalHealth Breast Center. Can you talk a little bit about the comprehensive care that is offered there?
We have such a great team at the Breast Center. I think a lot of people don't realize that we do screening imaging as well, so if you are looking to schedule your mammogram, you can do that there. But we've got nurse navigators who they're certified, they're trained especially in breast health. We have our imaging techs, your radiologists, your surgical team all all under one roof. So if there's any question or if there's confusion, they can kind of hold your hand and walk you through that whole process.
And of course, technology has come a long way in detecting breast cancer.
Right, so that 3D mammography or tomosynthesis is key. So we do that pretty standardly now so that it's like flipping through the pages of a book. Instead of just taking that 2D X-ray, we can kind of scan through each layer of the breast tissue through lots of pictures to see what is truly a mass, what truly warrants additional imaging or workup, and what is just dense breast tissue.
Sure, sure. A lot of women, and maybe men too, have anxiety when it comes to breast cancer, or even just getting a mammogram. What do you say to them?
So we treat breast cancer now with the intent to cure. So when we detect it early, there's like 98-99% survival rate at 5 years. So when we catch it early, which we can do with mammography, there's great outcomes. So don't be afraid to get the mammogram. Be afraid of not getting it, because we can treat something that we know is there.
Yeah, prevention is key.
It is.
Yes. Thank you so much, Carrie.
Thanks for having me.
With the TidalHealth Breast Center. Thank you.
Thank you.